Weekend Prime. Now tonight, we switch gears a little bit on this week's episode of Health Digest. You may know that human health and animal health are closely intertwined. After all, we share the planet with them, we domesticate them, and even depend on them for food. Their health matters, and any outbreak, such as a foot and mouth disease, which is a highly contagious viral disease that affects cloven-hoofed animals like cows, sheep, goats, and pigs, can greatly impact on their health. And while this disease is not a food safety or public health concern, experts caution that meat from carcasses of infected animals that are actively on antibiotics can fuel resistance among humans. On this episode of Health Digest, Gloria Milimu interrogates the disease that has seen flare-ups in Kajiado County and why it matters to humans.
An active outbreak of foot and mouth disease is ravaging Upper Matatu neighborhood in Kajiado County. Almost every farmer here has been impacted by the severe and highly contagious viral disease that affects cloven-hoofed animals. The disease is spreading at an alarming rate, and the impact on farmers is profound. We arrive at the home of Isaac Lomereta that is nestled on the slopes of Ngong Hills. And this is where we get to witness the impact of the disease firsthand.
Nilikuwa na ng'ombe 8 na hivi sasa niko na ng'ombe 4 hivyo. Wengi 4 hivi wameathirika juu ya huu ugonjwa ambao ulibreak juzi foot and mouth. Ng'ombe alianzisha kuonesha dalili ya kumwaga mate, wakaanzisha kushindwa na kukula. Tukarudi tena tukaona sasa ng'ombe wameshindwa na kutembea.
When foot and mouth disease strikes, it attacks animals like cattle, goats, sheep, and pigs, causing painful blisters in the mouth and on hooves of the affected animal. For Lomereta, this is the second outbreak the small-scale livestock producer is battling. And while the county government of Kajiado recently imposed an immediate livestock quarantine in its Ngong ward, for farmers like him, a vaccine would have prevented the loss and protected his animals. However, while county governments are mandated to manage veterinary services like disease control and animal health, the residents here lament that the targeted mass vaccination campaigns it used to conduct free of charge or at a subsidized fee allegedly stopped, leaving their animals exposed given the high cost of the vaccines used to inoculate the animals against diseases such as foot and mouth.
Mbeleni kabla haya magonjwa hayajatokea, serikali ya hapo mbeleni walikuwa wanatuletea chanjo. Wanatutangazia chanjo, tunakutanisha ng'ombe zote kwa pale kwa senda, tunachanjiwa ng'ombe. Lakini kwa hivi sasa imekuwa ni jitegemee. Na hii sasa jitegemee, saa ingine huna pesa.
Tumekaa kwa muda kama miaka 2 sasa bila kutangaziwa, hata bila kusikia hata wao walikuwa wanatutangazia na kukuja kwa maboma. Nilikuwa na kama kila ng'ombe ni 5 na wakaanza kupunguza. Sasa saa ile nilianza kuona hata hawakuli, ndio niliita daktari. Daktari akanidungia, alikuwa ananiambia ng'ombe 4,000 na akaniambia sasa alipozitibu akaniambia niziendelee kuzipema gadi. Hata kama sitaweza kusugua, ninafunguliwa mdomo na mtu namrusha.
Veterinary Dr. Edna Munialo from Kajiado recommends annual vaccination of livestock in order to confer protection against such diseases.
We do it once a year and during outbreaks.
Similarly, when they occur, just like in humans, when dealing with a highly infectious disease, quarantining the animals is a precaution she advises farmers to observe.
Most of them, they get this disease by various methods. We have by contact. aerosol, and also by the feed and contaminated water. Something else that is very important is for the farmers is to take care of their farms by also doing quarantine, in that they don't allow in and out of vehicles that are not disinfected. So they need to put disinfection areas, especially at their entrances. And in case there's a disease in that farm, then the farmers need to do isolation areas, and they need to have like 3 points, whereby we have the highly infected area, the red zone, where we put the affected animals. Then we should also have the yellow zone, whereby the animals that are not infected are kept. Then we also have the green zone, whereby we keep our feeds and other supplies to the farm.
Often when such outbreaks occur, questions around public health emerge. While you may wonder whether it is safe to consume meat from your infected livestock, experts say the disease does not affect humans, though there's a similar disease called hand, foot, and mouth disease, which is caused by a different virus from the one that causes foot and mouth disease. While drinking milk or eating meat from an animal with foot and mouth disease does not harm humans, Dr. Munialo cautions that it should be done in moderation, and that meat from animals on active treatment using antibiotics should not be consumed, as it can fuel antibiotics resistance in humans. This resistance often happens when resistant superbugs move to humans through the food chain, making infections much harder to treat with standard medicines.
So once the animal is affected, the viral load is high, and now it means that even the use of this milk or carrying it from one place to another means that you are transmitting the virus. And you should also note that during this time, the animals are being treated with antibiotics. And these antibiotics, they have withdrawal periods. And it takes long for these antibiotics to get out of the meat, the carcass. Remember, even there is antimicrobial resistance that happens when we consume the carcass that have been treated with these antibiotics that are used also in human.
Even as Kajiado County battles the ongoing outbreak, for farmers like Lomerete, having their animals vaccinated as per the recommended schedule is a precaution they cannot overlook. But even as they strive to protect the animals, both tiers of the government have a significant role in curtailing the spread of foot and mouth disease that continues to plague border regions and disease hotspots like Upper Matatu. Gloria Milimu, KTN.